We all know that poor posture, repetition of movements, and lack of exercise, all these things are major contributions to back pain. But there's one thing I bet most of you have no idea what I'm talking about. So today, I want to look at a few studies, and I'm going to break down exactly what this is. According to the World Health Organization, back pain is the leading cause of disability, and across the board, it's all cultures, and it interferes with your life, your work performance, and it is the most common reason for medical consultation. In the past, and especially, let's say, during the Industrial Revolution, jobs that were much more strenuous are always thought to have the ergonomic risk, right? For example, those who were picking up heavy loads or repetitively bending and lifting, chances are you had a much higher incidence of low back problems. And this makes sense, correct? Or lifting heavy objects and doing strenuous work may increase your chances of injury. But believe it or not, this is not what I'm seeing in my office from day in and day out anymore. It is from the office ergonomics, rather than the industrial ergonomics. And this is almost counterintuitive. And so the question is, why is this happening? So let's look at one of the key factors that could be causing the risk. And it's called psychosocial factors. I bet you've never even heard of that, never even thought of that. Let's go in and let's take a look at this. Let's look at the research. Psychosocial risk factors refer to the non-physical aspects of the job. There are a number of interrelated social factors that can affect and impact the psychological response to their work and the workplace conditions. Research has consistently shown that psychological risks in the workplace can affect the mental health and increase risk by, number one, increase in the stress hormone cortisol. Number two, increase in muscular tension. You feel it, like if you're stressed at work, you feel tension around your neck. Number three, increase in force exertion. For example, if you're using your keyboards and you're pounding a little harder when you're stressed. Number four, disturbing sleep. And this is necessary for your muscles to recover. And additionally, the worker may skip breaks if they're stressed and keep on task. And this leads to a reduction in muscle rest and recovery time. Obviously, these can make anyone susceptible to the development of injury. And researchers went on to say that specific psychosocial risk factors have the highest association with the development are low work support. The worker considers support received by coworkers and management to be too low. Low job satisfaction, the worker feels low contentment about their work, and high work demand. So the takeaway from all this is that we all know that force or repetition or poor posture have adverse effects in terms of back pain in the workplace. But the one thing most of us never consider is the psychosocial element or psychosocial risk factors. And so if you can imagine these things as this, each one of these are independent risk factors like four legs of a chair. And if one of these is not right, the person is going to fall over and hit the ground, right? Okay, so what I would suggest to you is try to incorporate all of these in as equal players. I hope you like this video. If you do, please like and subscribe down below, and we'll talk to you real soon. Enjoy your day.